We've got a great topic tonight, as usual, but I was just telling Sue before we got started, the discussion around neuropathy is something that comes up a lot. So I feel like any modality, any therapy that we can introduce to our members as a means to lessen that side effect is a good one. So we're really in for a treat for tonight. So I'm looking forward to it.
Can't agree more. And when you have science around something that's enjoyable too and brings you joy, like dancing, um, that piqued my interest a great deal. Yeah.
Absolutely. Yeah.
Mhm.
So, with that being said, I will say our topic for this evening is all about rhythmic movement and neuropathy. And we have one of the best in this space doing research, bringing this to her own patients with us tonight. So, we are really excited to kick off.
Absolutely. And then for those of you that are familiar with our education events, you know we can't do them, this UFH Connect channel that we have, without the support of our sponsors and our supporters. So I'd like to give them a wonderful shout out. UFH Connect is presented by West, Merck, Lilly, Novartis, and Gilead Sciences as our presenting sponsor. That is incredible support. With additional support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, and our supporting sponsors, AbbVie, Agendia, and TerraSera Therapeutics. Thank you all for everything that you do for us. And that allows us to have 40 plus live speaker series, Ask the Experts virtual hangouts with experts like Dr. Lustberg today. So thank you. Thank you to our amazing partners.
Yep, wonderful. And I am busy planning our fall education events, and there's a lot of good topics to come. So we look forward to having you in the months ahead. Before we jump into some reminders, I think it's worth just sharing some housekeeping tips. So please remember to keep yourself muted, but feel free to use that chat. There will be time at the end for questions, and Sue and I will be filtering through some of the chat as Dr. Lustberg moves forward. We are recording this segment as usual, so it will be up on our UFH Connect library as early as tomorrow. So you're always welcome to come back, rewatch, share this with someone that you think might find it informative and useful.
Yeah, agree. Aaron, people are still coming in. So it's a very, very important topic. And I'm glad that we're having such a good showing for this one.
Absolutely.
Very good. Yeah, so a little bit on the reminders. So as you know, if you're familiar with UFH Connect, we have 3 of these throughout the month. Every month we change up the topics, change up the presenters and the experts. On May the 21st, we're going to have at 5:30 our virtual hangout, which is about healing points, how acupuncture and acupressure support cancer care. We will be joined by Dr. Michelle Loy of Weill Cornell Medicine, who is a quadruple board certified in integrative care medicine, lifestyle medicine, medical acupuncture, and pediatrics. Dr. Loy will cover acupuncture's role in oncology and provide hands-on guidance on key acupressure points to address pain and nausea and fatigue and insomnia, hot flashes, and stress for individuals living with cancer. For those of you that know Unite for Her well and use Unite for Her passport in the Philadelphia, New Jersey, Delaware area, you know that we have a very robust acupuncture program. So we're happy to bring this as a virtual type of experience and education. And then on 5/22, May the 22nd at 12 p.m., that's Eastern Central Time, is our Ask the Experts, and that is what to know about radiation Q&A with Dr. Eva Berlin. So join us as Dr. Berlin answers all of your questions about radiation, including the effects on the heart, the skin, the energy levels, how it could affect breast reconstruction after mastectomy, plus side effects like nausea, weight loss, hair loss, and more. So we have a link that you can actually click on to submit any of your questions. We do love that Q&A effect, and we watch them live. So if we don't get to all the questions, we will make sure that we talk to Dr. Eva Berlin after the segment and then post them with the actual video and recording of this segment. So you will be able to get your answers, your questions answered. And then on 5/28, we have a virtual hangout, Build Your Mental Health Toolbox. We're going to be joined with the ecotherapy specialist and licensed professional counselor. It's Kevin Hubert. He's incredible. We've been working with him on a variety of different types of segments and so approachable, gives a lot of good tools to walk away from and techniques that you can use to improve your overall health and wellness, including anxiety and depression. So please mark your calendars for these events. We have 5/28, 5/22, 5/21. So a full month of May. We have 4 this month. Yeah.
Yeah, busy month ahead. So I think we should kick off this evening segment so we can jump right into it. So it is truly my pleasure to introduce our speaker this evening. So Dr. Maryam Lustberg is the director of the Center for Breast Cancer at the Cancer Center and Yale Cancer Center, as well as chief of Breast Medical Oncology at Yale Cancer Center. She's also a professor of medicine in medical oncology and has been widely recognized for her patient-focused care. Dr. Lustberg received her medical degree and completed her residency at the University of Maryland. She went on to the Ohio State University to complete her fellowship in medical oncology and joined their faculty in 2010, where she also earned her master's in public health. Dr. Lustberg continues her research efforts at Yale by emphasizing on improving the long-term outcomes for patients with breast cancer who have developed side effects associated with treatment. So please join us as we welcome our guest this evening, Dr. Maryam Lustberg.
Thank you so much, Erin and Sue. And this sounds like an amazing, amazing audience. Special thanks to Barbara for joining in from Yale. Welcome, everyone. So happy to talk to you all here. And I think we can be interactive about things. And although I will refer to breast cancer studies, I do want to just say that pretty much everything that I will talk about applies to other cancers. So you don't have to be a breast cancer survivor to find this relevant. And many of the regimens that cause neuropathy cut across all different cancers. So I'm so glad that we have good representation from other cancers here. So my neuropathy is a common problem. I don't have to tell you all. And so before I present our study findings, I'm going to give you an overview and touch on some of the existing non-pharmacological therapies you're going to be hearing. Sounds like you're going to have an upcoming lecture on acupuncture, so I won't spend a lot of time on that, but really promising things are being tested and researched. And I'm so glad that as a part of working with this group, you're given access to some of the best holistic care strategies, which I really do think is the future of how we do symptom management. This was drawn by a patient and many years ago, and I have borrowed it with credit. We know that chemotherapy does a lot of good. It has certainly, in the right setting, it has helped improve our cancer outcomes, no question about that. But also no question that it does impact us from head to toe. And although this particular presentation will focus on the neuropathy aspect of things, I think it's also important, again, you guys know this better than me, is that a lot of these symptoms coexist. So neuropathy can exist with fatigue and fogginess in the brain. So a lot of these things cluster together. We like to think of them as symptom cluster. And I think this is part of the reason that more innovative whole body approaches tend to be working much better as we try to tackle the problem of neuropathy, because taking a pill for it seems to be not as effective. It's very common. It doesn't always go away even when chemo ends. Lots of agents that we use for breast, gynecological cancers, and other cancers, particularly taxanes and platinums, which are commonly used in both cancers, are very often associated with neuropathy. And even though we have identified some risk factors, part of the hard thing about neuropathy is that it's a little bit unpredictable. So I can't walk into a patient room and say, you're the one who's going to have it or you're not going to have it. So a lot of research that I will not talk about is looking at, are there predictive ways that we can identify who's at risk? but nothing has officially panned out there. But I do have hope that some of the exciting research will hopefully lead us to be able to give you a better estimate of how chemotherapy will affect you. But that might be a subject of another talk. And we know that how it affects you is partly related to the drug, but also to your body. What makes you unique and how you metabolize all of these different drugs is part of why neuropathy is such a complicated issue. And it has, since chemotherapy has multiple targets, a lot of these targets have a lot of off-stream effects that can impact our nerve endings. And as I will make a case for you today, is that it's not just about our hands and feet. It actually affects our whole body, including our brain. So the idea of neuropathy being peripheral is really something that research is questioning, because it really does affect the brain and it has clear central processes. This was a diagram that my group and I did a few years back, and it's not meant to show you every little step of what goes wrong in neuropathy. But the point of this slide is really showing you why perhaps neuropathy has been so challenging. If we take a nerve cell or a neuron from just the beginning, every step can be impacted in terms of how these neurotoxic drugs enter the nerve cell, how they impact the nerve cell. So there are actually transporters that get the chemo into the nerve cell. And then there are metabolism pathways that can become over revved up. So there's absolutely an element of inflammation that we absolutely see. And exercise and movement is particularly good at calming down these inflammation pathways. So just a lot of steps that have to be overcome. So if you just have a pill that's just targeting one part of the pathway, it's not going to solve the problem because it's impacted by so many different things. So like many things in cancer, we have guidelines or recommendations. This is how we as clinicians give you all recommendations in clinic about what to do. And the guidelines have been not so helpful. I was a part of making these guidelines, so not disrespecting them in any way. But when we actually put together the evidence, what we found that we didn't have a lot of things that actually worked to prevent neuropathy. And this is very disappointing to hear to patients, because you want to know what you can do to prevent it. And at the time in 2020, and even if we were to update it this minute, the best tools that we have is kind of talking to you about the risks and benefits of chemo. There's no good supplement that has been shown to prevent neuropathy, and many of them can actually interact with chemotherapy. So we want to be careful there. And then we did in the guidelines started talking about several promising approaches that I will talk about, and that includes acupuncture, cooling, exercise. But at the time and even now, the level of evidence that needs to be there for these for the guidelines to include these as a valid treatment was not there. And so similarly, the Europeans did the same take on it, where they kind of we were beginning to acknowledge that exercise, movement, acupuncture, cooling are having promise, but we just didn't have those big powered phase 3 studies to put it in a guideline so that all of us can use our insurance to get these paid for. So these are kind of giving you a little bit of the background about why progress can sometimes happen slowly in medicine. Then when we looked at treatment, really only one medication, which has its own side effects, has been shown to be helpful, and that's duloxetine or Cymbalta. Some of you may have tried it and you may have not liked it or found it not to be helpful. But really, multiple drugs have been tried, and none of these tend to be super helpful for neuropathy. So clearly, lots of gaps. I'm part of a global organization called a MASC, or Multi-Association of Supportive Care Cancer. And so we said, great, all these guidelines are out there. What are patients actually doing in the real world? And we did this global survey, and a third of patients actually said that they were using non-pharmacological therapies. They were using cooling, they were using acupuncture. So they had caught on that our drug therapies may not be the most effective. Duloxetine, which is the one that recommended by guidelines, only 8% of the patients were using. And I think this is partly prescription coverage and partly patients may not want to take it for a variety of reasons. And it has side effects. It can have side effects. And so really, what the survey continued to emphasize is what you all are experiencing, which is that we don't have good solutions for neuropathy, and clearly we need to do a better job. And so it brought up to me, so this led me in the work of my laboratory to really look at exercise movement and really trying to understand how this may help. You know, we know the drugs are not necessarily helpful. And so this is kind of like a broad overview of why movement and exercise can actually help with neuropathy. So one is the effects of exercise on the brain. So helping those mitochondria in the brain, releasing these neurotropic factors that actually can calm inflammation down, improving this transmission of these good feel neurotransmitters that are so good for our brain. We also know that exercise it increases dilation of blood vessels. So some of these protective factors can get into our nerve endings. And then what we don't often talk about when we talk to our patients about movement is that depending on the type of movement that you're doing, so I'm sure some of you have done group exercise lessons, or even a group Zoom on Tai Chi or Reiki, anything that has that social component. We're all sitting together virtually, but we are a community right now exchanging ideas. So this psychosocial support is actually a key part of why these more group-based types of support can be actually so helpful and healing. They can improve mood. It's a form of social support, and they have been shown to be extremely helpful because cancer can be isolating, and sometimes being with peers who are going through the same thing can be particularly helpful. So one of the first studies on movement and exercise was done by my colleague, Ian Kleckner. He was at University of Rochester at the time, and now he's at University of Maryland, where he leads a movement lab where all he does is exercise, studies exercise. So there's a whole group of people that this is the science of exercise has really come a long way. And what he did is that he took a trial that was specifically looking at exercise and fatigue, because we know, again, these symptoms can cluster together. And we know out of all the interventions that we have for fatigue, movement and exercise is actually the most effective. And when they did the secondary analysis of patients, they saw that the patients who were in the control group not exercising regularly were compared to the people who were exercising a few times a week. We're not talking running marathons. We're talking moving your body a few times a week, nothing too intensive. They actually reported that they had less numbness or tingling in their hands and feet. And this is particularly compelling because this wasn't a specific neuropathy study. So sometimes, we wonder, like, is it kind of that effect of doing an intervention when it's a neuropathy study? Is that impacting what kind of that the power of our mind? But here patients weren't specifically thinking about neuropathy. They were doing this for fatigue, and even in that setting, the exercise group had much less symptoms of tingling. They started out roughly in a similar place, but then the exercise group was much less. So this is part of many studies that have really begun to look at movement as a way of mitigating these neuropathy symptoms. And so lots of other studies are in process, and I'm not going to focus. I'm promise I'm going to start talking about dance in a minute. But I think it's important in any talk for me to not make it seem like my intervention is the only intervention out there. I think there's a whole community of researchers that have really heard that patients need better solutions for neuropathy. So we are listening, and we're really investing in quality studies to address this question. And so just a quick zip through of what is going on, and then we'll get into dance. So one is an officially large phase 3 study looking at cooling and compression as a way of preventing neuropathy. This is open throughout the country. We have one site in Bridgeport, Trumbull. It's open to all patients. You don't have to be a breast cancer patient. So we hope to enroll some gynecologic cancers as well, because the regimens are used in both. And so some of you may be familiar with the scalp cooling machine. Well, the same maker of the scalp cooling machine has actually invested in also creating a cooling compression device machine. So you can actually cool your scalp and cool your extremities at the same time. And a question is always, well, is that cooling you too much? Is that going to impact things? And they before they launched this big study, they actually did very good careful analysis that it wasn't going to drop your body core temperature. And so a group of patients will get both cooling and this glove that delivers compression. The idea behind compression is that we're again slowing down the delivery of chemotherapy to these nerve endings. And then the second group will only get the compression. And you may say, well, why are you doing that? Well, studies have actually shown that compression may even work better than cooling. So they wanted to make sure that they included that. And then as a control, they're also putting in a group that gets this lower levels of compression. So everybody gets something. And we hope that this will be the definitive study that hopefully will help us get funding for this. Otherwise, till then, many oncologists are recommending now that patients just make their own cooling gloves. You can buy it for $40, or even just holding a bag of ice during treatment, cooling the feet. There's enough evidence now that we don't want any patient to be deprived of this potentially protective mechanism. Sounds like you have a wonderful talk coming up on acupuncture, and this is the definitive study that will hopefully get us coverage for acupuncture officially by my colleague and friend, Dr. Ting Bao. She was previously at Memorial Sloan Kettering and is now at Dana-Farber. And this is taking patients who are already symptomatic from neuropathy, and then they get to experience this acupuncture intervention at no charge. If you're near the New York, Boston area and are experiencing neuropathy, I wanted to make sure that you were aware that this is available. Unfortunately, it's not available all through the country, but it is a wonderful option to think about. And yoga. So she's also running a yoga study for patients symptomatic from neuropathy, also in New York and Boston, and a wonderful study based on smaller studies that, again, moving your body. We're not talking about intensive doing flips and doing complicated yoga, but gentle stretches and yoga really can help as we move our limbs in these rhythmic poses. It can actually be quite helpful. So I wanted to let you know that that's available. So the story of tango, so I'll be talking to you about a modified Argentine tango as an intervention for neuropathy. And the idea is not ballroom dancing. This is again been modified so that patients, individuals of all levels, of all ages can participate. This is not meant to be scary in any way, but the idea is when we think about moving our body to music, the connection between the brain and body can be quite powerful. And as oncologists, we can't take credit for starting this movement. It actually started with Parkinson's disease. So as many of you know, this can be a progressive, debilitating neurological condition. In no way am I comparing it to neuropathy, but balance tends to be an issue. And so there was several early studies in Parkinson's disease that actually showed how therapeutic it was to move to music, and so this idea of this adapted tango came. And you may say, why tango? Can it be any other type of dance? And my answer would be probably. I think it can be any type of dance, but to study this, we were building on this body of science. And so since these studies had been done in Parkinson's disease and really showed neurological improvement, this seemed like a wonderful intervention to further adapt for cancer survivors. And this is a quote that I do love, which again, in no way am I saying that everything is in the brain, or that no way am I saying that neuropathy is only in our brain. It's not saying that at all. But I do want to kind of emphasize that there are deep connections between the brain and body. And when we actually do interventions that address both, it can lead to some powerful changes. And we have kind of begun to study this in my laboratory team, where just 6 weeks of tango, when we kind of image the brain, we can see actually extra activation in the brain. Those circuits end up moving more and they get connected more. So it's the double impact, positive impact of music and movement, and your brain remembering to do the steps. So it's that 3-part process coming together, and we can see essentially our brains are overactive in a good way to do this. So we know multiple areas in our brain actually get activated as we dance and listen to music and try to remember these steps. And so it's we are building on just studying the brain and studying these pathways, and we really began to look at partner dance kind of for this very reason, that we had music, there were steps to remember, but we also wanted to bring that social aspect to it. So being in a class, having a partner, the partner could be an instructor, or it could be a friend or a partner that you bring with you. All of these things working together, it's hard to necessarily reproduce that in other ways. So these are all the different advantages of Argentine tango. And this work started almost 15 years ago. We started with a small pilot study. We enrolled 22 patients, and really started out small. And we started measuring balance. So there are balance plates. So if you can think about kind of as our strength and balance improve, there are these balance plates where if you stand on it, if you're wobbly, the area of balance is actually much bigger. But as patients kind of did more of these dance movements, what they found was that they actually had better balance. And when they stood on the balance plate, this fancy RMSML, you don't have to remember what that is, but it's a measure of balance, and it coming down was a measure that people were actually gaining better stability and strength as a function of moving their body to music. And as feasibility studies go, then that led us to apply for an external National Institute of Health grant called an R21 These are usually smaller 2-year grants, and that we focused on breast cancer survivors for this particular grant. And the idea was that we would take patients who were symptomatic from neuropathy, and we would do this adaptive tango intervention and compare it to home exercise, because we also know exercise is good for you. We're not saying that tango is the only thing. So essentially, we had everybody got something good, and the idea was, let's compare the two and let's see what happens. And I could not have done this work without my colleague Lise Worth and Chaudhary, who we started working together at Ohio State, and then she's there now, and now we're doing a larger multi-site study, which I will get to in a second. But she started out as a dancer, and then went on to get her PhD, and kind of studies biomechanics and kind of embedded arts therapy. So extremely creative, talented individual. And as science teams go, essentially in a random conversation, I talked about neuropathy in my patients, and she talked about dance, and we're like, we got to do this together. So this is kind of was the beginning of that partnership. So in these first studies, essentially, we really began to look at balance as a measure of neuropathy, because neuropathy can be really hard to measure. And what we found was that, patients who had more symptoms of neuropathy had worse balance, and that this continued even 1 to 3 months after chemotherapy. Again, something I don't have to tell you, in that as soon as chemo ends does not mean that all these symptoms disappear. And this has been supported by multiple studies that these debilitating symptoms can continue. And so we really wanted to our framework, what we built our research on, was that music is medicine, just like exercise is medicine, and motion is medicine, and really kind of that rhythmic movement. There was enough data in other conditions that we really wanted to test this in cancer survivors. So in this R21 from the National Institute of Health, we enrolled 52 patients, and remember that they were randomized to getting 8 weeks of twice-a-week tango delivered in a facility with an instructor. So they had to leave their home and come for this partnered class, and if they didn't have a partner would be provided, versus twice-a-week exercise at home, and they were given kind of support in terms of doing that. And we didn't want to necessarily say one was better than the other. We wanted to essentially study the feasibility of giving some type of a movement-based prescription to neuropathy symptoms. And the results, which we're in the process of publishing, and so I won't bore you with all the graphs, showed that regardless of which arm, symptoms improved. Patients reported the less symptoms of neuropathy. Their balance improved. So this type of movement actually led them to have better stability, and this was something that we could measure using very sensitive functional measures. And then it improved something really interesting that once I describe it, I hope you can relate to it. It's called dual task. So women are known to be really good at multitasking. So, we can look at our phones, be on a Zoom, be cooking sometimes even. And so you all know how much multitasking you do. So during and after chemotherapy, what has been shown in the literature and what has been described to me by multiple patients is that multitasking can become much harder. It takes a little bit more effort to be doing multiple tasks at the same time. And we think that this is part of the direct effects of chemotherapy on the brain. And so part of what one of our tests was really asking patients to do, get up, walk a certain way, walk back, and count backwards. So this is kind of one of those dual tasks. And it can be hard. It can be hard if I were to do it right now. So doing two things like that. And what was really exciting was that patients who had remembered and were doing those steps with the tango, it was kind of exercise on the brain, and they were better able to do the dual tasks. So it was really remarkable findings, and I'm showing you some pictures of the papers that we have published on this, and more to come on this. And this is one of the plots where, again, we're not pitting exercise against dance, because again, both are so good for you. And ultimately what matters is finding a type of movement that you want to do. So whatever that may be, it could be yoga, it could be going around a walk in the neighborhood. But what we found was this is again one of those things where they have to do two tasks, and kind of walk back, count. And so both groups, whether that it was exercise or dance, were at a certain level, and they were at a level where they were both kind of groups that were at risk for falls. So, and this dotted line is a threshold where we worry about a patient not having the best stability. And the good news is that just within 4 weeks, of moving their bodies twice a week, both groups had improvements in kind of this measure. So they were better able to dual task, they have better stability, they had less fall risk. And what was also important is that, you know, the numbers are smaller, but just that both groups improving was such an important thing. And it appeared that the dance group maybe improved a little bit more than the regular home exercise, but really the takeaway was that both groups were able to improve. So, you know, we all know it's good for us, but sometimes it can be hard to have the motivation when you're not feeling well, when you're fatigued. If you're in the Northeast today, it's kind of rainy and soggy outside. So it can be sometimes hard to have the motivation. And part of my hope in showing these data that all the things that we know are good for us actually can kind of translate to actual scientific data. And what's additionally extra interesting is that the music itself changes brain pathways. So here, this is what these balance plates look like. So patients kind of stand there with their eyes closed, and we're able to measure their balance. And then when we have them do the same task with the music running, so we can actually measure their electrical function in the brain and show that there is improvement in balance measures when music is running, just by the function of the music running. So it's extraordinary how connected our brain and body are. Back to the motivation, kind of like this is me talking to myself. I made a goal of exercising a few times this week. Yeah, I'll tell you maybe at the end how many I got to that. But motivation can be hard. And what was kind of, there are different levels of motivation. There is, you know, motivation of, you know, your doctor or your friend telling you to go on that walk or exercise. And then there's this intrinsic motivation of, gosh, I really want to go to that dance class, or gosh, I really want to go on that walk around the neighborhood because it's so beautiful out. So that kind of just motivation that's intrinsic, and you're not being pushed by anybody to do something, but you really want to do this and you're getting pleasure out of this. What we found was that motivation was high both for the tango group as well as the home exercise group, but this intrinsic motivation, kind of how pleasurable that activity was. Patients really enjoyed coming to class, interacting as a group, and that was more pleasurable to them, and that was associated with higher intrinsic motivation compared to exercise when you're by yourself at home exercising to a screen. So I think that social aspect of things is super important. But both groups were also satisfied, which was important. So I think this R21 was a small study, but the data were compelling enough that I will show you the study that we are doing currently, and it will be available at Yale. And any of you who are in Connecticut or near enough, we hope to open in August or September. But essentially, we showed that both dance and exercise improved symptoms of neuropathy, improved balance, improved our ability to do those dual tasks or the cognitive load that can be so hard during and after chemotherapy. And then kind of where dance seemed to be better, we need to verify it in the larger study, is that patients were able to maintain their balance improvements maybe a little better in the dance group. They certainly kind of found it more pleasurable and had more of that intrinsic motivation. And when we looked at electrical signals in the brain, small number of patients, but it seemed like the connectivity in the brain was a little bit better with dance, likely because we're exercising different levels of the brain body with music and tango. And so this led to a large NIH grant, which is 5 years, and it will enroll 140 patients, and they will have the opportunity to have these modified tango lessons, and half the group will not start immediately, but everybody will get the tango intervention. So we're not depriving anybody of an intervention because it's already shown such promise. So if they're more of a delayed start, they'll have a few measures taken and then join the rest of the group after 4 weeks. So we can offer it. And what we hope to show is that we're continue to see these improvements in neuropathy, continue to look at scalability. This is currently open in Columbus, Ohio, and then we hope to open in New Haven, and eventually I hope to expand to other parts of Connecticut, because I know commuting while you're recovering from cancer treatment or undergoing cancer treatment can be a lot to go through. So we're trying to make it as convenient as possible for patients, and learn who benefits the most, so that in the future we can also be able to say, this is the type of patient that you might benefit from this type of therapy, or you might be the type of patient that might benefit more from, I don't know, acupuncture. Or so I think as the science of these interventions continue to evolve, I hope that if I were to speak to you maybe 3 to 5 years from now, I would be able to give you more clear direction, because sometimes it can be hard to try a few things, especially if you're not feeling well. So with that, I will stop, and I'm happy to take questions or anything else I can help with.
That is so great. I'm smiling ear to ear. So good. I keep thinking about how I can enroll all of my dance studios here in the Philadelphia area to have a class for our breast cancer patients for tango. And we use it for their passport. That's what I'm thinking about.
We can think of that future study. Yes.
Ah.
I love that. We had a couple comments, couple questions in the chat. First, just some comments about the cold mittens and booties and tolerance of that. One of our attendees said they couldn't take the cold mittens and booties for more than 10 minutes. Is there, an amount of time that you usually advise patients shoot for, like, the entire duration of the infusion, try to stay on for, as long as you can? In that kind of scenario, what would you typically say?
So I'm glad she stopped, because I think it comes back to how not every treatment is for everybody. So the main toxicity with cold mittens, especially when we're not doing it as part of that machine, is that there is a small chance of frostbite. So I think if your skin is particularly sensitive to that, and it's not meant to be painful. So if you're experiencing that, it means that unfortunately this is not for you, and I'm glad that you stopped it. But for it to work, the idea would be that you have it on during the entire duration of the treatment, since chemotherapy is circulating. And the idea is that we're vasoconstricting those blood vessels so that the chemo drug is not going to those endings. Our hope is that if this more central study with the machine works out, it tends to be a little bit more tolerable, because it's delivering the cooling in a more uniform way. So our hope is that more patients would be able to tolerate it then. But unfortunately, right now, it's only available as part of that study.
Okay, something to look forward to. And can you reiterate the name of the acupuncture program at MSK? We had another question about that.
Yes, so at MSK, Dr. June Mao, if you look up the integrative medicine program at MSK, fantastic group, they're colleagues, friends. And so if you simply, MSK has wonderful websites. So if you just look under OSU, sorry, I saw the OSU comments. If you look up Memorial Sloan Kettering Integrative Medicine Program, and you call them and you say you're interested in the acupuncture study, they will help you. And then in addition, they also may have additional acupuncture programs that you may be eligible for. So I think it is an important group to connect with, particularly if you are close by.
Wonderful. Thank you for that.
That's
And Janice is,
Oh, do I just put in chat first? I'll put it in chat.
no, that's okay. You
You on mic, go ahead, go for it.
Yeah.
Okay, hi. So I'm Barbara. I'm one of Dr. Ratner's patients. Luckily, very privileged to be your patient. I call her my bond girl, by the way. I did not want to know. I'm a second-time survivor. I had different four-stage cancer when I was in my 20s. And I'm not saying this like to boast. I just did a lot of activity. I just have a lot of energy. So I've been dancing since I was 3 in ballet. Then I switched to jazz, and then I've done triathlon. So I'm a very active person, and this has been devastating to me. I was just diagnosed I'm a teacher. I was just diagnosed over break. My gut looked like I was 9 months pregnant, and I've just been going through it. And I've had quite a bit, dropping things, numbness. I think that we even think there's neuropathy in my one eye. So it was just very strange. And I always believe in a little bit of things spiritually. I also want to tell you a lot, but my son also passed away, and I saw Ben Christine on there. He unfortunately died at Children's Hospital, Philadelphia, from leukemia. So obviously I have a genetic thing going on here. But I saw him being in a wheelchair at the end. So I was just extremely nervous. And it's interesting that I immediately just asked at my first outpatient time to find out exactly what I had and all my pathology. My first question was, my friend was coming, and he is a dancer. He's a myeloma patient. I said, can I slow dance when he visits me? My intuition just immediately went to dance. And I've been dancing at home. I have a thing called Nia that I do. You might have heard of it, by Debbie Rosas from Oregon. She's a meditational movement, and it's very nice because it's not strict. It's a bunch of like people like me that have been dancers forever, and we don't love like a set. It's hard, when you want to go, you go left and you're embarrassed because you're supposed to go right. So this is a little more freer, but I love the idea that this worked with this tango, and I've never had the privilege of ballroom dancing. I just wanted to say, if I could, and I'm sorry to tell you my whole story, I just was really unbelievable to me, because I've been just trying at home to dance, and I trip and I fall. I was using a walker when I first came home. I've gotten a lot better. I rebound, but I think we're reducing me to only out of the 6, I've done my 4th one, and they've already reduced that pack. So I can't even say the name. They've already reduced it. Yeah. And Dr. Ratner conferenced in with Dr. Fenn, because I switched over to the smaller campus, and she said, like, we just want to give you one more blast. And I did. And I mean, I'm hoping I don't have to get any more, just because I've had this different things like hangers flying out of my hands, breaking mugs. I think I had neuropathy also because I can have no calcium. I don't make it for my first cancer. So sorry to ramble on, but this has been a huge concern of mine. And I have 2 more. I'll work with them on what we're going to decide for the next 2 because my markers and scans were good, but I do have 3B to 4 stage. So I want to know like how I can get into the study immediately. And I'm sorry to take up so much of your time. Thank you.
Your story matters so much, and you're welcome to reach out to me as well. Kathleen Fenn is actually the local PI for that cryocompression study. Yeah, so it's actually where she is. So
I do it, and my kids are all grown, and they came, and we call it the orangutan. I like your guy. They provided some for me. The ones I got on Amazon were great, and I kind of been powering through it, even though it hurts. And I do it. I honestly, I have severe, sorry, it's probably tell like I'm talking fast. I have a lot of like some mental health issues as well over the years. And with different, like I think with my son and all different things, not to make excuses, but I use ice to calm me down, and I can barely like go to these infusions, to be quite honest. And the ice is actually, it works for me because it makes me not have a panic attack, believe it or not. A lot of psychiatrists use ice in therapy to stop you when you're panicking, in any kind of situation. As if you cancer, if you can use ice. I don't know if you've heard of that. I also brought a roller ball in. I have an ice roller ball that my same myeloma friend got me, and it rolls. And now a bunch of the nurses over at the one Fairfield Smilo beach, they ended up just buying them to have there. So I just wanted to thank you about the ice therapy. And also I was told, though, it doesn't at home. No, it's only during treatment, right? Like there's not anything to wear the mitts or feet things at home, right?
Yeah. So it would be just during treatment. Yes, the cooling would be just during treatment. And then I would look into both making sure physical therapy has been, we didn't specifically talk about physical therapy for neuropathy, and I do feel that they're underutilized. So a specific referral to a physical therapist close to you. They can also do a lot of very evidence-based interventions to help with balance, to help with the falls, to help with the manual dexterity. So I would definitely also ask for that if it hasn't been offered.
Yeah, that and acupuncture. And I always bounce back. Like this round, my 4th, and I was getting 20% less. I believe I got 20% this time too. I've bounced back, but when my eye got a little funny, I don't know that's probably not anything you could address, but there is such a thing as eye neuropathy, correct?
So eye neuropathy is very, very rare and unusual, and I would want to absolutely make sure that there weren't other causes first. But theoretically, these neurotoxic chemos can impact any nerve, and certainly our eye is very innervated for sure.
I'm sorry to ask one more question. I think I had COVID, and I had the one that symptoms like this, that's what reminds me of. And they told my kids, she'll feel like either flu or COVID. And I had COVID before the vaccination. I also got a bunch of the vaccinations, and I got COVID again. Is there anything that you can further address at one point? And I asked my Clarice, she's my APRN, she said that was a really good point. And are you doing anything with long haul COVID studies being related? Because I swear it's the same headaches and it's the same body symptoms that I have
So Yale actually has a long COVID clinic. It has a long wait list, but there is actually a very wonderful group of researchers that are studying long COVID. So I think Dr. Fenn can kind of help.
Okay, I really appreciate everyone.
Great.
Thank you for answering. Thank you.
Thank you.
Thank you, Barbara. Not a problem at all. We have a couple more questions here, Dr. Lustberg. So one was wondering about the effects of GI neuropathy too. So could you just talk a little bit about that?
Yeah, and I'd be curious kind of if they could kind of comment a little bit in terms of how that's manifesting. Our gut is the second most innervated organ in our body. So it's been understudied, but yes, I think it's absolutely possible. Constipation, yeah, that would be the most common thing. So it can be hard to tease out if you're currently on chemotherapy. Certainly, chemotherapy itself can cause constipation, but after the fact, know that, yes, I think it's absolutely possible. We don't have the best solutions for it, but continuing to do supportive measures for constipation, like ensuring you're getting enough hydration and getting enough fiber, and then using motility agents as needed. It's something that needs to be studied more. So I can definitely take that back to our neuropathy research group.
Okay, and Dr. Lustberg, I had this question, and I don't know if it's too far off topic or not. So, do you think that Dr. Lustberg would know anything about neuropathy and platelet-rich plasma injections?
PRP, yes. So I know that it's PRP platelet. So that for people who don't know, it's taking your own blood and spinning it and getting these rich components, and it's being studied or given kind of commercially for a variety of conditions, from vaginal dryness to hair loss. And I imagine that somebody may be even saying that it could be used for nerve endings. I'm not disputing it, just that the quality of data is still very limited. So I would just be cautious about who's doing it and making sure that you're not facing kind of commercial strain from somebody saying something that maybe just deserves to be studied a little bit more. But certainly as an educated patient, you can make your own mind about the pros and cons. But what I would say is that we have very limited data. So I don't know if it's truly good or limited, but it may be something that over time we'll have more data for.
Right. And then one was asking, can neuropathy actually cause blackouts, then fall, right? Like, is that connected at all?
So I think the connection would be with a condition known as orthostatic hypotension or orthostasis. So the idea, it falls under the category of autonomic dysfunction. So this is if you're seated and then you suddenly stand up. If you have an element of that autonomic neuropathy, it can, your blood pressure drops really fast, and then you could potentially pass out, or you may feel dizzy. So yes, it could be a less common presentation of neuropathy, but I would encourage whoever is treating you for that to also keep a broad differential, that we don't always assume it's neuropathy, because there are other both cardiac as well as central things that could also cause that. But yes, it's not out of the realm of possibility that it would be that autonomic neuropathy.
Wonderful. And I know we had a question early on, just going back, and I think you did clarify this, Dr. Lustberg, but in terms of cold therapies and particularly compression, that's something that would be most useful during treatment. Would it be useful for someone if they were a few years out, or would they not get the same potential benefits?
Yes, so it's if you have completed chemotherapy and you currently have neuropathy, cooling is essentially cooling or compression is a preventative strategy, unfortunately. So it would be only during the time of receiving chemotherapy. It would not be helpful after. But if you have those chronic neuropathy symptoms, that's where kind of exercise, movement, yoga, acupuncture, physical therapy, and then if it's that neuropathic pain component, certainly considering neuropathic pain medications as indicated. So those are going to be your tools, and less so that cooling. That would only vasoconstrict you, but there's nothing you're not getting additional drugs, so it's not going to be helpful.
Got it. And I love the fact that you kind of framed that as like you have your tools, depending on what you're experiencing, you have lots of things. And I know Janice was looking for an online modified tango program. I think that would be something we would all love to learn about. So if you know of any online programs, please share them with us.
Yeah, so that's something that we can definitely work toward, kind of as I kind of talked with my colleagues in terms of how we can make this more accessible. So I will take that back, so that perhaps we could kind of even put some videos online as a resource that perhaps you guys can distribute.
We had a few questions, Dr. Lustberg, and I did direct them to the American Academy of Acupuncturists, and it's a place where you can find an acupuncturist. That is one of our specialties at Unite for Her, and we have probably over 50 in our area that we refer patients out to. Our advisors are dual trained, so I just wanted to talk about that just a little bit. If you could add anything more, I would love your feedback. But I know when we're looking for an acupuncturist, it is wonderful, like Dr. Junmao, that they're both trained in both Western and Eastern medicine. So they do have this comprehensive approach to your cancer care.
Yes.
Most of our acupuncturists in our network are dual trained. If they're not, then our advisors actually do vet them and make sure that they have all of the qualifications to treat an oncology patient.
Yes.
Is there anything more you would like to add to that, Dr. Lustberg?
Just to re-echo what you just said, which is, I know we have a shortage of qualified acupuncturists, and then so access to them is a huge issue. But if there was a choice, if you are fortunate enough to live in an area where you have a choice of a few, I think making sure that they have treated patients with cancer, I think is really important, because we actually have evidence-based protocols for specific cancer-related symptoms. And I find sometimes that when they don't have that cancer expertise, they don't follow those.
Mm-hmm.
And so there are very specific protocols for nausea. We have phase 3 data for arthralgia syndromes for some of the anti-estrogens. And so I would just, if you could see the kind of everything Sue said. So just, but I know it can be hard to find someone and expensive sometimes. So it's challenging.
Yeah, it's calling.
Yeah, absolutely. One of the reasons why we do have it in our area is Philadelphia, New Jersey, and Delaware, but it is something that we really make sure that the patients know that they can talk to their oncologist and their acupuncturist and have them connect on your care. That should be a comprehensive approach. There shouldn't be this feeling of an either
Yes.
or push-pull.
Yes,
So
yes, we're
anyone that you
all
find,
on the same team.
yes, yes.
Somebody
So
asked about this.
whoever
Yes.
you find, try and get them to connect with your oncologist and have those conversations so they know you as a person and your symptoms and some of the things that you're going through. Sorry to interrupt you there, Dr. Lustberg.
No, thank you. No, we really strongly believe in the same thing, Sue. And so there was a question. I know I'm missing some of the questions, but there's a question about massage, and I absolutely I think it comes back to the tension between, how much data do we have? Was there a study specifically conducted on neuropathy and massage? There's not going to be a big study that has done that. Is massage going to help you feel better and might get the blood flowing and help with some of the pains and aches? Absolutely. So we don't always have to wait for kind of the strongest level of evidence. So I think give it a try. If it's right for your body and is helping the symptoms, absolutely.
Great.
All right.
Trying to see if we got through a lot of them. Erin, did you see
One,
the ivermectin one? Did we talk about that one yet?
no. Any thoughts on ivermectin and whether or not that helps neuropathy?
Mm-hmm.
So it's a little bit similar to PRP, which is that we are hearing that it's being touted to help with many things, from cancer therapies to infection to now neuropathy. I think that the evidence is limited, so I would exercise caution. This is not me again, like the way I approach it with my patients, which is your body, you decide what you take, but let's have open dialogues so that I can be sure that the ivermectin is not interacting with any of the therapies that we're giving conventionally. I don't think the data are strong. It doesn't mean that in the future they may not be strong, but at this point, I'm kind of on the fence and a little bit cautious about it. But again, your wonderful viewers can make up their own minds.
Wonderful. Okay. And then maybe we wrap up with just your thoughts on compression. Should a person buy compression socks, kinetic tape? Is that perhaps part of a long-term maintenance sort of program to support nerve function and movement? What are your thoughts on that?
So all the compression data that we are aware of outside of lymphedema. So in terms of lymphedema management, absolutely compression sleeves and all those things, definite good evidence to support it. But in terms of kind of a more chronic neuropathy picture, whether compression is helpful or not, I don't think we have clear evidence of even what the optimal compression levels should be, what the optimal pressure would be. So this is again where I would love to learn from the audience. So if you're trying things out and you want to share, these are things that I am happy to take back and then develop kind of additional data to try to help future patients. But right now, I would say the only data I can officially share with you that has been shown to be helpful is essentially anything like a tight glove or taping that is restricting blood flow to a small degree, so less chemo is getting to the nerve endings. That's what my science has, not my science, but that's what the data has shown. So I don't have good data to tell you to go use compression sleeves after neuropathy, after neurotoxic exposure. So it's something that we may need to generate additional data for. I would worry mechanistically that we know that increasing blood flow with exercise and movement is what helps neuropathy symptoms. So I actually would worry that it may have a counter effect to what we want, because we actually want the blood flow to be flowing and giving you those good factors in there. So I would not personally recommend it based on the level of evidence for chronic neuropathy unless you have lymphedema.
Got it. Wonderful.
Very fair. Yeah. Oh, thank you, Dr. Lustberg. This was a great segment. I am, as you can see, we have a lot in our audience, a lot of good questions, and it just really is so helpful that you're able to bring some other ideas to our community that could be very helpful, like this whole dance exposure. And I love that Barbara said, I just had a natural, I wanted to dance like before my radiation or before my, and I know movement is so key for so many reasons. No matter what you choose, movement is so key. But to hear the studies with dance, I just think that opens up our world and our community's world to think again, right? Like maybe that Fred Astaire studio down the road, you might just want to take a class, right? And go in and do some group dancing. And you don't have to be a professional, right?
No. And I really love this audience, and you have all given, research ideas actually start from these types of exchanges. So you have all given me ideas, and I would love to have future partnerships and future conversations, because there's a lot that we can learn from each other.
Perfect. Yeah, I think that's a beautiful way to end. It is a
Absolutely.
collaborative approach, and we do learn from our community, and they agree. I agree, Dr. Lustberg. They are dynamic, and they help us obviously expand the way we have at Unite for Her over the years and give us knowledge, and that patient voice is always what drives us and is always forward in all that we do and everything that we deliver at Unite for Her. So thank you for saying that as well. I'm actually very pleased to announce that Dr. Lustberg is one of our newest advisors at Unite for Her. So she is on our medical advisory team. We are just welcoming her. You'll see those announcements come over on social and on our LinkedIn. But Dr. Lustberg, thank you for just giving us your expertise and your experience. And there have been so many people that kept saying, you must connect with Dr. Lustberg. You guys are two peas in a pod. You have to connect with Dr. Lustberg. So I am so grateful that we have you tonight as our guest. So thank you for your time. We appreciate you.
Thank you so much.
Thank you.
Good night. Thank you.
Good night. All right, Erin.
Amazing.
That was wonderful. Yeah.
I don't know about you, but I am like ready to dance.
Oh, I'm ready. I am ready.
And I love that Barbara said she danced at a wedding this weekend. So let's like put on our stable, balanced dancing shoes and get moving.
That's right. That's right. I love that. And just on a personal note, I will be celebrating my daughter's wedding next week. So I will be
You'll be doing a lot of dancing.
I will.
Get ready.
Yeah. Well, Erin,
Amazing.
thank you. This is a wonderful segment. I loved all the studies. Definitely have some wonderful segments that we can put on social just to tease it out so that people get more interested that, may not have joined us. So thank you all for joining us this evening. And I would love to just take this time to thank our sponsors again. Those presenting sponsors have been so key to everything that we do here at Unite for Her at this UFH Education Connect, which is so, so valuable. So again, with support from West, Merck, Lilly, Gilead, and Novartis, they are our presenting sponsors, and our gold sponsors, GSK, Pfizer, Daiichi Sankyo, supporting sponsors, Agendia, Terracia, and AbbVie. So wonderful, wonderful segment. May is just a great start.
It is on a great start. And hopefully I will see many of you next week. We've got 2 segments that I will quickly tease. We've got our virtual hangout. You heard Dr. Lustberg. We will be joined by Dr. Michelle Loy. She's talking about acupuncture and acupressure in support of cancer care. So that's the 21st at 5:30 p.m. Eastern time. And then we've got our Q&A all about radiation. Dr. Eva Berlin will be streaming that live on Facebook on the 22nd at 12 noon Eastern time. So follow us on Facebook, Unite for Her. She'll be answering all of your Q&As all about radiation, both acute side effects and what to know about that, plus that long-term perspective. So hopefully I will see most of you next week. Sue, we will not see you, but I'll let you know how it goes.
You will not see me. I will be dancing. I will be dancing. Back to that acupressure and acupuncture segment. They're doing some things for self-care that you can actually learn, that you can do your own. So we just felt like that was very important so that we can empower you in a way that you can advocate for yourself and know these pressure points for nausea, sleep, pain. So Dr. Loy will be talking about that. So I thought that was very.
I love that. I love that takeaway. Yeah, that's something that we can all use. So we look forward to learning, and we'll share a few things with you once you get back.
I can't wait. All right, everybody. Thank you for joining us. Happy May 15th.
Thanks for being here, everyone. See you next time.
Bye.